How to get pregnant. How can you get pregnant faster? How to conceive. In this video today, we are going to talk about how you can get pregnant faster. You have asked a question, how can you get pregnant faster? How can you conceive faster? This video, we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster. How can you conceive? If you are a couple and you have tried to get pregnant, then this video is for you. Without further ado, we shall discuss the fact that if you are trying to get pregnant, there are 4 things which need to be in order. The first thing is that your ovaries should be functioning very well. The next part is that your fallopian tubes should be open. If you have fallopian tubes which are blocked either by free fluid or they are blocked by adhesions or tissue, then there are high chances that you could get pregnant, but you could end up getting pregnant with an ectopic pregnancy. Remember, an ectopic pregnancy is a type of pregnancy which is outside your uterus. It is a type of pregnancy which actually occurs in the fallopian tubes or any part outside your womb. The next part or the next key thing, if you are a couple and you are trying to get pregnant, is that you should be free from disease of the uterus. Your womb should be free from fibroids. Your womb should be free from issues like endometrial hyperplasia, where the inside of your womb actually becomes very, very calcified. So we are discussing all this and we are going to answer the question, how can you get pregnant? How can you get pregnant faster? So if you are looking at getting pregnant faster, then you should just make sure that your ovaries are okay. You should make sure that your fallopian tubes are okay. And then also you should make sure that you are free from disease of the reproductive system, for example, fibroids. Next thing, which is very key, is that your husband should be having what we call semen analysis, or your husband should be having sperm count which is of good quality and good quantity. How can you confirm that all this is okay? How can you confirm that your ovaries are okay? You simply have to do some tests on your ovaries to confirm whether you are ovulating very well. You can use the ovulation predictor kits, and then also the fallopian tubes. You can go ahead and do an examination or a test known as an HSG examination, whereby pictures will be taken of your fallopian tubes and any blockage will be identified and then treatment can be given. Next is, if at all you have disease of the womb, for example, if you have fibroids, then there are high chances that your doctor will put you on medications. Most of the commonly used drugs for fibroids are called gonadotropins. These have to be prescribed by your doctor. Next is that if your husband has semen which is of poor quality, if your husband has sperms which are of poor quality and poor quantity, then there are medications which can be given to increase the sperm quality, to improve the sperm quantity. So we have answered the question, how can you get pregnant faster? If you have any questions, feel free to ask them down below this video in the comment section. If you would like to have a private consultation with me, you can contact me through my website www.gerardmassa.thehealtheducator.com. Have yourself a fantastic and healthy day, and may God bless us all. See you in my next video. Bye-bye. How to get pregnant faster with one fallopian tube. How you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation. You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today. I welcome you to this channel. On this channel we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerard Massa, the health educator, is the name of the channel, and I welcome you, my friend. Stay with me, watch this video to the end. We are going to talk about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a very simple recipe. It has worked, it is working for many couples. It will work for you to watch this video to the end, and we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a simple recipe. So what is happening is that we shall begin by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember you can easily get pregnant very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses. And then when you begin counting from the first day when you saw your menses, then there's going to be the 14th day. That is when you are actually going to be ovulating. So if you are a woman out there and you have a regular cycle, and even if your cycle is irregular, still you just have to pick out a particular month which is really okay, which has been consistent, and then you basically have to count from the first day when you saw your menses, count up to the 14th day. When we talk about your cycle or your menstrual cycle being regular, specifically we are talking about knowing that the menstrual cycle is divided into two phases. We have the follicular phase, and then we do also have the luteal phase. So when you have your periods on day 1, then you see your periods on day 2 and then day 3, what you need to do is basically count from the first day you saw your periods, that is day 1, and then count up to the 14th day. And on the 14th day, that is when you are going to be ovulating. That is when you are most likely to be ovulating. So what happens is that the 3 days leading to ovulation, during the 3 days leading to ovulation, there's a release of a hormone. This hormone is known as luteinizing hormone, also abbreviated as LH. This hormone stimulates the whole process of rupture. So what is happening is that when you see your menses on day 1, then there's going to be a release of a hormone known as luteinizing hormone, and this hormone is specifically responsible for the rupture of a mature Graafian follicle. A mature Graafian follicle is basically a mature egg. So when we take a look at this diagram, you realize that the whole of this is what we call the reproductive system. This is the reproductive system of a woman. It has actually several parts, but we shall talk about them in a nutshell. We have one ovary this side, and then another ovary, and then we do also have the fallopian tubes, and then we do also have the fallopian tubes attached around here, and also these ligaments which support the ovaries. So the whole of this is basically layers of tissue. It's known as the myometrium, and then the outer thin layer is what we call the perimetrium or the epimetrium, and then we have the inner layer, which is known as the endometrium. What happens is that when an egg has been released, it's going to grow. When a woman has just seen her menses, when a woman has just seen her menstrual cycle, or when a woman has just seen her periods, there's going to be growth of these eggs from a very small size, and then it goes on growing until it matures. So the first stages when the egg is growing, basically this is known as, okay, then the first stages when the egg has just started growing, it is known as the follicular phase. Follicular comes from the word follicle, whereby there's growth of a small egg. It goes on growing until it matures into a ripe egg known as the Graafian follicle. The whole process of maturation, the whole process of growth of this egg until it reaches this point of being very mature, ready to be released, this whole process is supported and it is stimulated by a hormone known as luteinizing hormone, working together with another hormone also known as estrogen. But luteinizing hormone is the most important hormone here. It plays a very big role in helping the maturation and then the rupture of this mature egg. When this mature egg ruptures, this is what we call ovulation, and normally there will be semen released, and this semen can come in, the male sperms can come in, and then they can meet around here, and then fertilization can take. So thank you once again, my friend. We are proceeding with the whole process of ovulation, and we have said that when the egg has been released on the 14th day, basically this is what we call the day of ovulation, or the day when you are most likely to get pregnant. But still, the 3 to 4 days leading to ovulation, still you can get pregnant. Having talked about this, we are going to answer our question: is it possible for a woman to get pregnant when they have only one fallopian tube? The answer is yes. It is very possible. The most important thing you have to do is you need to understand your ovulation calendar, and then also you need to understand that when the fallopian tube is not blocked and the fallopian tube does not have any issues with maybe fluid inside it, then there are high chances that you can easily get pregnant. What you need to do, or what you need to know, is that the fallopian tubes should be patent, or they should be open. It is very easy for a woman with a fallopian tube which is open to get pregnant, as long as the tubes are open, and then as long as this particular woman is actually ovulating very well. So when you are a woman and you ovulate very well and you have one fallopian tube which is not blocked, then you can easily get pregnant. Though in most cases there are times when your fallopian tubes may be blocked, still this has to be confirmed by your doctor, whereby an investigation will be done. This investigation is known as the HSG, or the hysterosalpingogram. It's an examination whereby your fallopian tubes will be analyzed under a special technique, and when the report comes out that your tube is blocked, unblocking can be done in hospital. So we are talking about how to get pregnant faster with one fallopian tube, and how to boost ovulation naturally with just a simple recipe. And we have said that during the process of ovulation, as long as a woman is ovulating very well until the 14th day, she can always get pregnant faster naturally. And then the other most important thing is that you need to understand how your cycle runs. You need to understand that if you are a woman and you have a cycle that runs for 22 days, then the days you are ovulating are going to be between day 6 and day 10. And then if you are a woman and your cycle runs for 24 days, then the days of ovulation are on day 8 and day 12. All together until when you reach 45 days, still the days of ovulation are between the 26th and the 30th day. So having known all that about the menstrual cycle and then the calendar method, we are going to talk about one simple recipe that can help you get pregnant faster, and this is what we call citrus fruits. Citrus fruits are very, very important. It's actually very important because it contains lots of vitamin C, which is very important. It is very key in handling, and it acts as an antioxidant, and it basically works on free radicals in your body. But in fertility, in managing fertility cases, it actually boosts fertility because it contains a very important element. It contains a very important substance known as polyamine putrescine. Polyamine putrescine is very important because it has been known to boost egg quality, and then also it has been known to boost sperm quality. So if you are a woman, if you are a couple trying to get pregnant, make sure that you consume some citrus fruits because they do contain polyamine putrescine, and then also they do contain they actually contain vitamin C, but in this particular case the polyamine putrescine is very, very important because it boosts sperm quality, and then also it boosts egg quality. We have been talking about how to get pregnant faster with one fallopian tube, and we have said that you just have to make sure that the fallopian tube is not blocked, and then you should be ovulating very well. If you are not ovulating very well and the fallopian tube you have is actually blocked, then it may be a bit difficult to get pregnant faster. The other thing is that how to boost the ovulation basically faster. You basically have to go on and then take lots of citrus fruits because they do contain polyamine putrescine, and then also polyamine putrescine has been known to boost sperm quality and egg quality. According to a study which was done by Dr. Murphy, polyamine putrescine is known to boost sperm quality and egg quality. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend. I thank you for staying with me for this while, and I hope you have learned something in today's video. What you need to take home is that you should take lots of citrus fruits if you are a couple trying to get pregnant, and then the next thing is you should know that you can get pregnant easily even if you have one fallopian tube, as long as you are ovulating well, and then as long as your fallopian tube is open. You can connect with me on my WhatsApp numbers. They are just around the corner down here on the right side. You can connect with me in case you have any questions. Also remember, what is a baffling cyst? In this video today we are going to talk about the baffling cyst. Hello my friend, I welcome you to our channel, Gerard Massa, the health educator. On this channel we talk about the ovulation calendar, we do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. By the end of this video, you are going to know what a baffling cyst is, and what is a baffling cyst, and how best it can be treated. So without further ado, we shall define a baffling cyst, and we shall say that a baffling cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a baffling cyst. So we are going to look at the symptoms of a baffling cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk. and then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina, known as the labia majora, and specifically one side may be very, very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very, very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cysts? What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cowpeas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bartholin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bartholin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bartholin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bartholin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video we are talking about Bartholin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bufferin glands, and the Bufferin glands are around the size of pea, that is PEA, cowpeas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bufferin cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bufferin cysts. So it is very, very important that when you have a Bufferin cyst, you should be able to get treatment, and the best way of preventing Bufferin cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. Gerard Massa, the health educator, is the name of the channel, and in this video today we have talked about the Bufferin cysts, and we have said that these are swellings which become of the Bufferin glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. To subscribe for new videos we release every day. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerard Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. The signs and symptoms of a twin pregnancy. Twin baby pregnancy symptoms. Conceiving twins is our lesson for today. We are going to look at what are the signs and symptoms that you are pregnant with twins. Gerard Massa, the health educator, is the name of the channel. We are talking about the signs and symptoms of a twin pregnancy. Are you pregnant? Do you suspect that you could be carrying twins? Then this video is for you. Keep watching. After this short message, I'm coming back and we are going to talk about the signs and symptoms of a twin pregnancy. Thank you. Thanks a lot, my friend, for staying around, for watching our video for today. And by the end of this video, you are going to be knowing all the signs and symptoms of a twin pregnancy. Gerard Massa, the health educator, is the name of the channel, and I welcome you, my friend. If you are new here, remember to hit the subscribe button, click the subscribe button so that you get new videos we put out every day. On this channel, we talk about women's health, we talk about fertility, ovulation calculator. We do also give pregnancy tips. Subscribe so that you get new videos every day at exactly 17 hours East African time. So without further ado, we should talk about this very important point, that it's only an ultrasound scan that can confirm that you are carrying twins. It is the best way to confirm that you could be carrying twins, but still there are other signs and symptoms which are very important, and they can also help us tell whether you are pregnant with twins or you are carrying a single baby. So what is happening is that some mothers who are pregnant with twins say that they suspect they could be carrying twins, but still they may be having some signs and symptoms. But the truth is that while there are several signs and symptoms of a twin pregnancy, there's also tremendous overlap with the signs and symptoms of a singleton pregnancy. A singleton pregnancy is a type of pregnancy where you are having a single baby or a single fetus. It is impossible to definitely know whether you are carrying twins or multiple babies by simply gauging how you feel or going off of what a home pregnancy test shows. So you cannot do the home pregnancy test with the urine HCG test and then say that you are carrying twins. No, you are going to get results. Still, you will get the positive results, but this is not a conclusive way of telling that you could be carrying a twin pregnancy. So we shall go to the first sign and symptom of a twin pregnancy, and this is more morning sickness. There's a saying about twins that twice is really much. Twice is really much. So what is happening is that if at all you are carrying more than one baby, then if at all at first you are pregnant with one baby, you will get morning sickness. But imagine if you are carrying two babies. If you are carrying two babies or even three babies, then the morning sickness is going to be more. So the first sign that you could be carrying a twin pregnancy is that your morning sickness will be increased. The morning sickness will be a lot. So if you are a woman out there and you are pregnant and your morning sickness, the morning sickness is much as they call it morning sickness, but it is basically that feeling of weakness, that feeling of you're tired, and it can actually come throughout the day. Though they call it morning sickness, but it can actually happen throughout the whole day. But in twin pregnancies, it is going to be much. It is going to be increased. So the first sign that you could be carrying twins is that your morning sickness will be doubled. Next sign of carrying twins, next sign that you could be carrying twins is elevated beta HCG levels. Your beta HCG levels will be elevated, and remember, when we talk about HCG, basically we are talking about the human chorionic gonadotropin hormone. This is the hormone that is released when a woman gets pregnant. It is released by the placenta. It is also released by the corpus luteum, in early pregnancies when fertilization has just taken place. But when the fetus has implanted, or when the baby has implanted onto your womb, then the placenta begins producing the HCG, plus other parts of the body also they could also produce the HCG. So the levels of the HCG are going to be doubled. You cannot conclusively distinguish a single pregnancy from twins on a urine pregnancy test, but still when you do the blood HCG test, the levels are going to be increased. They are going to be doubled. Next pregnancy symptom is that there's going to be severe fatigue. We talked about the morning sickness being doubled. So the next sign that you could be carrying a twin pregnancy is that you are going to be having severe fatigue. Extreme fatigue is the most commonly reported complaint during pregnancy with multiples. So if you are a pregnant mother and you are experiencing extreme fatigue, then there are high chances that you could be actually carrying twins. In some cases, the fatigue can be attributed to other factors, and these include stress, work, and then also poor nutrition, not feeding well, and then having other children you are taking care of. Then still, this means that you could be overworked. But if at all you are pregnant and you are having extreme fatigue, then it is basically very important that you go ahead and talk to your doctor, who will request for some tests to be done, some tests to be performed on you. Another point we need to take is that fatigue is rather a subjective symptom and has many other causes. if at all you are pregnant and you are fatigued, you feel tired a lot, please consider talking to your doctor, who will order some tests. These tests may include a CBC or a complete blood count. Here, a whole check will be done on your blood cells, whereby your doctor will look at your white blood cells, the white blood cell count, the red blood cell count, and then also your platelets. Any abnormalities, any deviations from the normal, then this could actually mean that you could be having another cause or something else causing the fatigue. For example, low hemoglobin levels or having low HB levels. Still, this can be managed if at all it has been identified. If you are pregnant and you are having extreme fatigue, please talk to your doctor so that some tests may be done. If you are in the tropics, like in Africa, this could be, the extreme fatigue could be due to malaria. It could also be due to infection. Next, pregnancy symptom to confirm that you could be carrying twins is abnormal AFP test results. Abnormal AFP test results. When we talk about the AFP, we are talking about the alpha fetoprotein. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. It's also known as maternal serum screening or multiple marker screening. It is used to identify increased risks of certain birth defects. So, if you are pregnant and your levels of the AFP, that is the alpha fetoprotein, is really high, then you could be actually carrying twins. But remember, the alpha fetoprotein test is used to detect increased chances of getting birth defects. So, a twin pregnancy can produce an unusually high or positive result. Still, when you do this alpha fetoprotein test, which is used to detect birth defects, but if you do this test in your hospital or in a nearby hospital or health facility and the results turn out to be positive, please consider talking to your doctor. This could be a sign, this could be a symptom of a twin pregnancy. If you do this and then you go ahead and do the obstetric ultrasound scan or the pelvic ultrasound scan, and it turns out and it shows that you are pregnant with one baby, but you have an abnormally high alpha fetoprotein test, then please you need to repeat the ultrasound scan, and your sonographer or your doctor doing the scan should really pay more close attention, because the baby could be having some birth defects. For example, birth defects including cardiac issues or defects of the nervous system, like for example the spina bifida. So whenever you are pregnant and you have an abnormally high alpha fetoprotein test, then it is very important that you go ahead and talk to your doctor. Next pregnancy symptom to really tell us that you could be pregnant with twins. Next symptom is that you'll be measuring large. Throughout your pregnancy, your doctor or midwife will measure the height of your uterine fundus, measuring from the top of your pubic bone to the top of the uterus. To measure the uterine fundus, measurements are done from the top of your pubic bone. The pubic bone is specifically that bone in your pelvis up to the top of your uterus, that is around your umbilicus or your umbilical cord. This is a method by which estimation of the gestational age is done, but still, if at all the results come out and they are not conclusive, then your doctor or your midwife will request for an ultrasound scan. A twin or multiple pregnancy may cause the mother's uterus to expand beyond the range of a single pregnancy. However, other factors may also increase the measurements. This measurement is more difficult in earlier pregnancies or when the pregnancy is in the early stages, whereby your midwife will basically record that the pregnancy is palatable or it is basically palpable. But later on, as the baby is growing, this measurement is very, very key. It can actually give us a clue, because if at all the measurements for the expected age. If the baby is expected to be 20 weeks, but your measurements are way much more higher, then you could be actually carrying twins. You need to confirm with your doctor you could be carrying twins. Next pregnancy symptom to confirm that you could be carrying twins is fetal movements will be increased. Feeling a baby or babies move inside your womb is one of the most thrilling factors of pregnancy. This is also known as quickening, or the time at which you first feel your baby. This occurs between 18 up to 25 weeks. This is basically in the 3rd and the 4th trimester, but it can also, it actually begins in the 3rd and the 4th trimester. This is between 18 to 25 weeks, but is usually detected earlier on in subsequent pregnancies as early as 16 weeks. When women feel movement in early pregnancy, this is normally, actually it is a sign to show that the baby is well, to show that the baby is okay. But when the movements increase, then it could actually be an indication that you could be pregnant with twins. Next pregnancy symptom to confirm that you could be carrying twins is there's weight gain. While mothers of twins only gain about 10 pounds more than singleton mothers, the amount of weight a woman gains often depends on her height, the body type, and how much she weighed before the pregnancy. So much of the increase in weight gain occurs later on in pregnancy, often after an ultrasound has already confirmed or excluded a diagnosis of twins or multiple babies. So weight gain is one of the signs and symptoms that you could be carrying a twin pregnancy. In twin pregnancies, your weight will actually double. Gut feelings and hunches is our next pregnancy symptom to really tell us that you could be carrying a twin pregnancy, while the other types in this list refer to some kind of visible evidence. Exaggerated symptoms, abnormal test results, increased morning sickness, and more can also be used to really say that you could be carrying a twin pregnancy. Lastly, the most important point we are taking home from this video is that you should do what we call ultrasound scanning. Seeing is believing. The only way to confirm that you could be or you are carrying twins is by doing an ultrasound scan. Specifically, you do what we call a pelvic or obstetric ultrasound scanning, though in most cases your doctor will opt for an obstetric ultrasound scanning because it is much more precise, it's much more on point. It is very unlikely that an ultrasound scan would miss an additional baby. At least an ultrasound scan can show that yes, there's a second baby somewhere. However, there have been cases of hidden twins. In particular, a hidden twin is more likely on an early ultrasound scan than when the baby is actually much more grown. Thanks a lot, my friend, for watching today's lesson. By the end of this lesson, I hope you've learned the signs and symptoms that you could be carrying a twin pregnancy. And yes, if you have any questions, ask me all your questions down below in the comments. I will be very happy to answer all your questions. Remember, the signs and symptoms that you could be carrying a twin pregnancy is that there's increased fatigue, there's increased morning sickness, there's elevated beta HCG levels, there's increased alpha fetoprotein levels, there's severe fatigue, and then also the movements will be increased. And then there are also other things which can be detected, but still what you need to do is you should do an ultrasound scan to go ahead and confirm that yes, this is a twin pregnancy. Gerald Massa, the Health Educator, is the name of the channel. I thank you, my friend, for watching today's lesson. Remember to subscribe for new videos we release every day. Like, share, and hit the bell for notifications so that YouTube will show you the new videos we put out every day, the new videos we release every day. On this channel, we talk about pregnancy, we talk about the ovulation calendar, we do talk about women's health. Have yourself a fantastic and healthy day. May God bless us all, and see you in my next video tomorrow at exactly 17 hours. Bye bye. Take care. God bless. Bye. Hello, welcome to our channel. I'm Joan Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.